let's take a look at the formation of white blood cells. Hematopoiesis is the process by which all blood cells, including white blood cells, are formed. This process occurs primarily in the bone marrow, although certain types of WBCs undergo further differentiation in other tissues, such as the thymus for T lymphocytes. The process of white blood cell formation begins with hematopoietic stem cells, which are pluripotent cells capable of differentiating into various types of blood cells. This stem cell will divide into one of two types of cells next. It will become a myeloid progenitor cell or a lymphoid progenitor cell. The myeloid lineage gives rise to several types of WBCs, including granulocytes, which are neutrophils, eosinophils, basophils, as well as monocytes. Granulocytes are produced from a precursor cell known as a myeloblast. Myeloblasts undergo further maturation to become the various granulocytes, depending on the signals they receive in the bone marrow. Monocytes mature in the bone marrow. Once in the bloodstream, monocytes can migrate into tissues and differentiate into macrophages or dendritic cells. The lymphoid lineage gives rise to lymphocytes. B cells and T cells originate from a lymphoblast in the bone marrow, but then migrate to specific sites for further maturation. B cells mature in the bone marrow, while T cells mature in the thymus. Natural killer or NK cells also arise from the lymphoid lineage and mature in the bone marrow, but do not undergo the same differentiation process as T and B cells.